Supporting the physical health of serving personnel, veterans and family members is important for the overall health of the armed forces community. This video provides an overview of themes and topics related to the physical health of those in the services and beyond. The Covenant states that the armed forces community should not be disadvantaged due to service. Healthcare, treatment and rehabilitation for serving personnel is delivered by the Defence Medical Services, or DMS, in close partnership with the NHS. NHS care is delivered in accordance with the Covenant, which states that armed forces serving personnel and families should retain NHS waiting list positions even if they have to relocate due to service. The DMS treat personnel in the UK, overseas and at sea. The DMS provide general practice, specialised occupational health services and a tiered defence medical rehabilitation programme. The DMS provide healthcare to 136,000 regular personnel. The DMS is staffed by 8,200 regular personnel, 4,000 reserve personnel and 2,500 civilian personnel. It is reported that regular armed forces personnel are at a significantly lower risk of dying prematurely compared to the UK general population. This is due to what is known as the healthy worker effect. 55% of injuries sustained by armed forces personnel and MOD civilian employees occur during training. The Defence Medical Rehabilitation Centre at Stanford Hall near Loughborough is the MOD's main facility for the rehabilitation of injured service personnel in the UK. Inpatients at the DMRC are classified according to the severity of their condition, with 38% of inpatients classified as very seriously injured. Personnel who sustain physical injuries such as limb loss may continue in service if they regain sufficient medical fitness. If personnel are unable to return to sufficiently productive service, they are likely to be medically discharged from the armed forces. The main causes of medical discharges between 2015 and 2020 were musculoskeletal disorders and injuries. These led to 51% of Army discharges, 48% of Naval Service discharges, and 39% of RAF discharges. Certain demographic groups are significantly more likely to be medically discharged. These include females in the Army and the RAF, naval service personnel aged 30 to 39, and untrained personnel, which are personnel who have not completed Phase 1 training in the Army. The Covenant state that veterans should receive priority treatment where it relates to a condition which results from their service in the armed forces, subject to clinical need. In the UK, healthcare is delivered to veterans and families through the NHS and other initiatives. Research suggests that primary healthcare professionals need a greater awareness of armed forces culture and the potential specific needs of veterans and their families. Steps are being taken to rectify this, for example, through the veteran-friendly accreditation program for GPs and training on veteran specifics through the Royal College of General Practitioners. There's no difference in the self-reported general health of veterans and non-veterans in the UK. The following numbers reported their general health as very good. Age 16 to 64, 35% of both veterans and non-veterans. Age 65 plus, 18% of veterans and 20% of non-veterans. A study on Scottish veteran mortality found that longer-serving veterans were at a lower risk of death than early service leavers. Research suggests that the veteran population experiences higher levels of hearing loss and tinnitus, with veterans under the age of 75 being 3.5 times more likely to report difficulty hearing than the general UK population. The following are among COBSIO charities providing physical health support for the armed forces community. Further information which expands on this video is available in the Physical Health Snapshot on the VFR Hub.